Hello and welcome to another live stream of Dr. Barbara Miller's comprehensive NCLEX review. Today, the topic will be on chest tube and the condition that requires a chest tube insertion. Okay, so let's get started. Uh, so, what is a chest tube? A chest tube is also known as a thoracic catheter. Is a sterile tube with drainage holes inserted in the pleural space. Okay, and the main purpose for chest tube is to drain or remove air, fluid, or blood from the pleural space or re-expansion of the lung. Okay, so what are the conditions that requires a chest tube insertion? It could be pleural effusion. Pleural effusion is accumulation of fluids in the pleural space, fluid accumulation between the visceral and the parietal pleural of the lungs make it harder for the patient to have adequate gas exchange. What is a gas exchange? The inhalation of uh, O2 and exhalation of carbon dioxide. Other risk factors for that requires a chest tube insertion: hemothorax. And what's a hemothorax? Accumulation of blood in the pleural cavity. Or a pneumothorax. Pneumothorax is air leaks into the pleural space. Pleural space is exposed to positive atmospheric pressure, uh, and that interferes with the lung expansion. You have different types of pneumothorax. So let's go over the types of pneumothorax that could impact negatively on our patients. You have spontaneous pneumothorax, okay, and this is more prevalent in the male gender if they are very tall and thin built. Okay, so what's a spontaneous pneumothorax? Is a rupture of tiny air sac, okay, or the visceral pleura. This can appear suddenly without any warning, okay? Just be mindful, it is prevalent in the male gender. Then you have tension pneumothorax. And what is a tension pneumothorax? Is the buildup of pressure in the chest, okay? Tension pneumothorax. And then you have traumatic pneumothorax. This could occur by chest wall piercing. It could be from any sharp object that pierced the lung. It could be from a gunshot wound, a knife stabbing, a scissors, any sharp object that causes a pierce in the lung that could cause traumatic pneumothorax. Air enter the chest, causing the lungs to become smaller than it collapses. So, with all these conditions that requires a chest tube, post-surgical intervention, cardiac surgery, a chest tube is inserted to prevent complications. And towards the end, we're going to talk more about complications from a chest tube. Okay, it ensures that the fluid and air is drained fluently from the pleural space. So you do have types of chest tube. You have wet suction, versus dry suction. Okay, so the wet suction of the chest tube, it regulates the suction pressure by the height of the column of water in the suction control chamber. So the nurse responsibility is to monitor the water level. Okay, it determines negative pressure. Negative pressure minus 20 centimeters of water. Then you have your dry suction. This type of suction uses a self-control regulator that controls the amount of suction. So the nurse responsibility is to monitor the suction. This indicated by an inflated bellow or dial setting. So what's a bellow? A bellow is a valve that creates a seal. Okay, so go over two types of suction that they utilize in a chest tube: your wet suction versus your dry suction. Now let's talk about the chambers. You have 3 chambers, and I'm going to demonstrate it shortly on my drawing of a chest tube. So let's go over the chambers. You have your drainage collective chambers, collection drainage from the pleural cavity, and that is located on the right side of the chest tube. Okay, then you have your water seal chamber. The water seal chamber is the underwater seal. It fluctuates with inspiration and expiration. So the water seal chamber has sterile water and acts as a one-way valve, preventing air from entering the client's chest cavity. The water seal level in the water seal chamber rises and falls, inspiration and expiration, and this is known as titling. Okay, then you have your suction control chamber. What is that? Your suction control chamber is in a wet suction system. It controls the levels of water in the suction control chamber. If you were to ask, it is usually set at minus 20 centimeters of water. So your suction control chamber is usually set at minus 20 centimeters of water to maintain negative pressure. Those things they will ask you on your State Board of Nursing examination. Okay. You do have the dry and wet suction that I explained before. Okay. So you're to go over when you're talking about suction control chamber, know what's the dry versus wet suction. So you're assessing your patient. Patient is on the chest tube. You want to check the patient vital signs, their blood pressures. You also want to check their blood oxygenation, saturation, their respiratory rate. You want to assess for pain. You want to assess for respiratory status. You want to auscultate lung sounds to see if you're picking up any adventitious sounds or abnormal sounds. You want to monitor for signs of infection at the insertion site. Drainage, be mindful that the drainage, you want to monitor for normal uh, drainage. If it's less than 100 milliliter per hour, you want to notify the healthcare provider. If the drainage is over 100, okay, you also want to, it must be in between. You want to note the color, unexpected bloody fluids, and cloudiness could be indicative that the patient is bleeding or the patient is developing an infection. So if you're seeing bright red bleeding, you want to notify to the healthcare practitioner that the patient is draining red blood. If you see dark red blood, you just document because that signifies old blood. Okay? No drainage. You want to assess your patient first. That's the top priority. You want to check for breath sound is the top priority when you're checking your patient if there is no drainage. Let's talk about the water seal chamber. If the water seal does not fluctuate, there is a kink or the lungs have re-expanded. Just be mindful of that. If it does not fluctuate, it could be that the patient lungs has re-expanded, or you want to check for kink. At times the patient may be, twisting and turning, and the catheter may picked up a kink. So you want to unkink. Air is removed through the tube, but air is prevented from entering the lungs. Continuous bubbling is not a good thing. Yes, the patient could have intermittent bubbling, and that's fine. But continuous bubbling signifies an ear leak. Patient with pneumothorax, intermittent bubbling in the water seal chamber, you want to assess for dislodgement. Remember, patient who has a pneumothorax, okay, you will see intermittent bubbling. It could be indicative that the tube has dislodged or disconnected. Suction control chamber, wet suction chamber, gentle bubbling is noted, and that's okay. Other consideration you want to look at, you want to maintain chest drainage system below the patient's chest because it's going to drain with gravity. You want to ensure the connection is secured. You want to watch your step. You don't want to touch the suction chamber, which could cause the chamber to tilt over. You want to keep the tube free from kinks and obstruction. Do not milk the chest tube. The boards will ask you. You're stepping out of your scope. Do not milk the chest tube at all unless indicated by the physician. You want to avoid clamping the chest tube without a prescription. You do need an order to clamp the chest tube. Drainage breaks, you want to insert the tube in 1 inch into a bottle of sterile water. If it dislodges the chest tube, you want to cover the insertion site with sterile dressing and tape 3 sides and notify the healthcare practitioner. So what are some complications? What are some complications of a chest tube? Air leakage is one complication. Continuous rapid bubbling in the water sealed chamber. So, as a nurse, what would be the nursing intervention? You want to start at the chest and move down the tubing to locate any leak, tightening connection, or replace drainage system. You want to keep the connection taped securely. If no titling, okay, what is titling? The rise and fall of the chest, or the inhalation and exhalation. That could mean that the lungs has re-expand, or the tubing is kinked. No bubbling in the suction control chamber. You want to verify the tubing is attached. Verify water is filled to the prescribed levels. You want to check the wall suction regulator. Chest tube is disconnected from the system. What's the intervention that the nurse would apply? You want to insert open end of the chest tube into the sterile water until the system can be replaced. Chest tube accidentally pulled from the client, and that could happen. You want to cover the insertion site with a sterile dressing taped on 3 sides. Contact the provider and prepare for reinsertion rather. This is my chart on the chest tube. On the right side, you have your drainage, your collection drainage. You are to know what the collection drainage, if I could get it up, what the collection drainage signify. It's to do what? And you are to know the water seal drainage and your suction control drainage. You got to remember that it has to set at minus 20, that's the suction control, minus 20 centimeters of water, okay? This is my drawing. I'm not sure if you could see. Minus 20 centimeters of water to maintain negative pressure in the system. Those things the boards will ask you. So you're going to go over your water seal drainage, okay? The water seal chamber of the chest tube, it has to fill with sterile water, and it acts as a one-way valve, preventing from air from entering the client's chest cavity. The water level in the water seal chamber rise and falls with inspiration, and I'm repeating, and expiration, and that is known as tidling. Your suction control chamber, which is usually set at minus 20 centimeters of water to maintain negative pressure in the system. Those are the things that you will be asking on your NCLEX state board. Now, if the lungs re-expand and they are deciding to remove the chest tube, you got to know that you're the nurse or the nursing student. If you were to call to assist, the client should be instructed to take deep breaths, okay, and bear down, utilizing the Valsalva maneuver. the Valsalva maneuver to prevent air from re-entering, okay, the pleural space and possibly causing pneumothorax. So Valsalva maneuver. Post procedure, they want to check x-ray, chest x-ray rather is needed, okay? There is a high incidence of IV iron causing hypersensitivity reaction, which could lead to anaphylaxis. So during chest tube removal, and I'm repeating, ask your patient to take deep breaths and bear down, also known as the Valsalva maneuver. And why they're doing this is to prevent air from re-entering the pleural space and possibly causing a pneumothorax. Okay? The drainage, remember, if the chest tube is disconnected with contaminated and cannot be immediately reattached, or the chest tube unit breaks, cracks, or malfunction, you want to submerge the distal end of the tube 1 to 2 inches below the surface of a 250 milliliters or cc bottle of sterile water. And that's your chest tube. I'm not able to show, it's not wide enough on the screen to show you the chest tube. Remember that it has a air leak monitor which can detect the water seal if there's any leakage in the water seal drainage. Okay, so please go over, know that your collection chamber, the purpose is to collect fluid from the patient, directly from the patient. Go over the complications of chest tube, because you may ask that on your boards. Know that the suction is designed to regulate the amount of the suction chamber, designed to regulate the amount of suction applied to the pleural cavity. Go over your dry suction versus your wet suction. Know that the dry suction, you want to monitor suction. This indicated by the inflated bellow. And know that the bellow is a seal valve. You also want to monitor the wet suction. Monitor the water levels. It determines negative pressure at minus 20 centimeters of water. Are there any questions on the water seal drainage? Any questions? So if there's no questions, tomorrow I will speak on mechanical ventilation. Thank you for watching. I hope this live stream be beneficial in the preparation of your study for your State Board of Nursing examination. Sorry, my throat is a little bit dry. Okay, thank you so much.